All right, next we'll move to presentations. So Doña Ana County Community Resource Center's annual report. Jamie Michael.
Good morning, Commissioners. Jamie Michael, County's Health and Human Services Department. I'm extra excited to present this year our Community Resource Center annual report because in December of 2001, the County Commission created our department. So we are getting ready to celebrate 25 years of our HHS department. A few months after that, they hired the first director for our department, Sylvia Sierra. I'm proud to say I was able to work with her for many years. And she came from a nonprofit background focused on family resource centers. So she was the one who really started utilizing the county buildings as community resource centers. The scope of what the county has done with those community resource centers has evolved over the past 25 years, and it started with AmeriCorps Vista volunteers. So there were not any county staff hired to do programming and provide services at the community centers. It was all AmeriCorps Vista volunteers. We have two of those original AmeriCorps Vista volunteers that remained, that are currently employees of our department. We've had several over the years, but we still have two of them with us. The scope of our department as it has evolved, and this is reflecting last year's focus, we've always conducted health-related programs and services, and we use the community resource centers as a way to do that throughout the county, so to decentralize the services and the education that we offer. We employ promotoras now, so we have over a dozen employees in our department that are certified promotoras. They do a variety of work, but instead of relying on AmeriCorps Vista volunteers, now we have employed promotoras. We have health educators that work out at the community centers and across the community. We also have a network of partners and contractors that provide services directly at those facilities. So to do all of this, we really utilize the community resource centers. Generally speaking, our department also follows the county health rankings model. You've probably seen this diagram if you've seen any presentations about our department. We look at policies, programs that contribute to health factors, and those health factors contribute to health outcomes. And health outcomes are measured by both length of life and quality of life. And when we look at those blue boxes, those are the health factors. And this, the weight of how impactful each of those are on our health is cited across a variety of literature. So it really is an accurate reflection of what contributes to our length of life and quality of life. So if you look, there's 30% of our length of life and quality of life is attributed to our individual personal health behaviors. Am I eating right? Am I not smoking? Am I wearing a seatbelt? All of those things. 20% relates to the clinical care, so how accessible is care and what is the quality of care. 40%, so the highest percentage there, is related to social and economic factors, and you can see examples of those social and economic factors. And if we look at what promotoras are great at doing, it directly relates to those social and economic factors. And then also the physical environment, again, our air quality, water quality, housing and transportation, all of that contributes to our quality of life and length of life. So throughout our department, we try to use this model to address, again, quality of life. Here is a list of all of the community resource centers that we operate in. We have some centers that have full HHS programming, so that means there is at least one full-time employee there providing their 40 hours worth of work at those facilities. You can see the day and the time. They're open much longer than 40 hours a week. So in order to get that, we do rely on volunteers from the community. We rely on community organizations and contracted partners. So that's a list of standard operating hours for each of the centers. Some of the centers say senior meals only because we do not have an HHS employee at those facilities, but our contractor provides senior meals there, and so those centers are only open for limited hours for that, that function. And then we do utilize one of the centers for the monthly food distribution program. Outside of these hours, we do special events and activities frequently throughout the year, but they're not part of the standard hours of operation. This is a list, again, of all of the community centers where we have an HHS employee, so the full HHS operations. And you can see last fiscal year, we almost hit 50,000 encounters, so over 47,000 encounters. Number of times someone walked into the building to access services. We had close to 7,000 activities across all of those centers, and this just lists the demographic by age for each of the community centers. So we do see that the overwhelming majority of people who utilize the centers are adults. That makes sense because there's more hours in the day that adults are available to go to the community center while young people are in the school. But we have seen an increase over the years in the number of young people using the center. The data that you see here and that you'll see on the next slides is not exact, because if someone doesn't want to give us their age, we say, welcome, come in. It's fine. If you don't want to sign in, that's not going to be a barrier. The data collection is all still done manually. So again, there is not that automation factor that allows us to be 100% accurate or gather the 100% of the information. But it gives us a good indicator. And again, the purpose isn't to gather good data. The purpose is to offer a safe place for people to come. So we definitely don't require them to sign in or give us information. But it is nice to be able to look back and see what we've accomplished. This is the comparison of fiscal years. It took a while to bounce back from COVID. The centers were closed during that time, and it did take a while to bounce back. Last fiscal year, FY25, is when we finally reached where we were pre-COVID time, and you can see this past fiscal year, the number of encounters increased from there. So I would say if we look back across our 25 years, that last year was one of the highest numbers of encounters that we've seen in our history. The types of encounters correlates with the county health rankings model. So those blue buckets there, we correlate the data collection based on that. And again, this is not always 100% accurate because one activity can fit into more than one box. But this gives you an idea. There is a lot of focus on the social and economic factors. So we look at the total number of events, close to 7,000. Of that, 2,000 were related to social and economic factors. Health, behaviors, clinical care, physical environment. We also document and try to give people a variety of activities. Here's some examples of the social and economic factors. We have a Nuestra Familia program. It focuses on caregiver, child-adult attachment, social-emotional development. Through that program, we do offer opportunities for new moms, grandmas, caregivers to get together in things like support groups or social groups just to talk about their experience. Sometimes it revolves around learning how to use your car seat correctly, so it's a skill-based class, but behind that is let's build community resilience and community connections across caregivers. We do have childcare providers on site at 2 of our centers. They are not licensed childcare providers, so the caregiver has to stay in the building, but it allows the caregiver to focus on the class that they're there for, and it gives the child a safe place. Child care centers. We do a lot in the summer with the young kids, the summer lunches and youth and recreation in the summer with our staff and throughout the year with our contractors. Health behaviors, obviously, this is a big one. We do diabetes management and prevention at community resource centers, also at other types of community facilities. In Gadsden, we do a lot with the family resource centers. Our staff is out talking about 988, talking about the crisis triage center, talking about mental health first aid, and offering those certification classes across the community centers. And then our team of health promotion staff and promotores each month have something called Topic of the Month. So it's just a variety of topics that they will go out and provide the same class across all the community centers. We also focus on access to health and social services. Again, the promotoras are key to connecting people to resources. They help reduce isolation. We had a physician with La Clinica down in Chaparral prescribe, go to your community centers so you can interact with people as something important for the individual to do to help with depression symptoms. The promotoras at the community center, because they are there full-time, they build trust with the relationship, and they're able to provide that social engagement and connection. The building trust is important. In my time here, we have responded to several emergencies, natural disaster type of emergencies. And I know when Stephen was with OEM, we partnered, because after a natural disaster, when we need to reach out to community, you need a trusted voice. And the promotoras are, after the things have been made safe in the community, the promotoras are the first one out there knocking on doors, checking on people, and communicating with people after natural disasters. We were also well poised to do vaccine clinics in communities and get information out during the time of COVID. We support food distribution and senior meals as well. There's a variety of special events, community meetings, resource fair, again, the resource navigation. I think many of you have seen or been to winter celebrations. We also utilize the community centers as cooling and warming centers throughout the year as needed. Some added value. We do have members of the community that want to volunteer. They can get their volunteer hours for some of the state supported programs. They can get volunteer experience that helps with job training. So they're informal career pathways that are set up at the community resource centers by working locally with people in those communities. We're great liaisons between the county and constituents about, again, everything from responding to natural disasters to lights on your roadways and other things that we're hearing from community members that we're then able to share with county leadership and elected officials. The community centers are a safe place to convene for families. Other organizations have been able to use the community centers, again, as a safe place for them to connect with people. And because they're located in the community, not every nonprofit organization or healthcare facility is going to have a building in every community, but they're able to utilize the community resource centers, and that is a great partnership with different organizations. So this just illustrates what we can see and what we can count are those encounters and activities, but what we can't see is everything below the water. And the community centers are often referred to as the heart of our department or the heart of the community. These are other words that we hear people use when they describe the community resource centers and the promotoras. These things are not always measurable, but we know that they are happening. I also want to recognize that this is the beginning of National Community Health Worker Awareness Week. So Pam and I are joined today by three of our staff, Sharon, Selena, and Ariana, who are here. Ladies, you want to wave? Community Health Worker Awareness Week. So Pam and I are joined today by three of our staff, Sharon, Selena, and Ariana, who are here. Ladies, you want to wave?